Very frequently, women come to the office with a complaint that they've been going to the bathroom very often. And women are a lot less alarmed by this symptom because they're used to it from having urinary tract infections when they were younger. This thing called honeymoon cystitis where right on the honeymoon, women might get a urinary tract infection. And urinary tract infections are a lot more common in women than they are in men, simply because the anatomy is very different. Now, the urethra in a woman is much shorter, about 3 centimeters, rather than a man, which is much, much longer. And being so short and so close to the bladder, you can see how it doesn't take that much work for the bacteria to get out of the vagina or make it from the rectum and crawl into the urethra and up into the bladder. The distance is so short that it really doesn't take much. Now in men it's a different story, because in men, first of all, there's no vagina that has normal flora, normal bacteria to supply the bacteria. But even if there was bacteria all around, for that poor bacteria to make it all the way upstream from the tip of the penis all the way into the bladder, let me tell you, it takes a lot of work. So the bacteria sort of give up on it. Now, if a man had a urinary tract infection, that would be a big deal, because that's considered by definition a complicated urinary tract infection, and that by itself warrants a full workup. Means we have to figure out if they have bladder stones and all sorts of stuff. But if a woman has a urinary tract infection, it's considered a simple urinary tract infection or uncomplicated, certainly if it's the first time that it happens, because it's really so common, and physiologically you don't have to have anything wrong with you other than having normal female anatomy to have a urinary tract infection, because the urethra is so short and it's so close in proximity with other organs that have normal bacteria in them. So you don't even have to have anything wrong with you, and you can have a urinary tract infection, and you can have frequency, which is one of the symptoms. You can have urgency, which means that you have to go to the bathroom right away, and you can even have hematuria, so a little bit of blood in the urine. That's not uncommon with a urinary tract infection. Now, if it happens with more frequently than normal, so if you're having more than 1 or 2 urinary tract infections within 6 months, then this is something that you should have looked at. But certainly if you have 1 urinary tract infection per year, there's usually nothing alarming about that. And there are lifestyle changes, including drinking more water or cranberry juice or other things that we know can help with urinary tract infections, that you can do to minimize that risk. So frequency is usually a urinary tract infection, unless it happens more often than you would want it, or certainly that you would expect it. Then we have to look at exactly what's causing it, and make sure nothing else is wrong, to exclude other reasons.